Doctors of Reddit, what's the most miraculous recovery you've ever seen in a patient? I have a few. I'm a pediatrics resident and kids have some ducking magic. Took care of a 23-week preemie. For reference, 40 weeks is how long a typical baby takes to bake. The dude was just 600 or so grams. Now survival is a little less than 50% if you look at the most up-to-date data. Long-term issues are a near guarantee if they survive. This kid was on an oscillator, IV antibiotics, the works. He suffered a perforation in his bowel due to necrotizing enterocolitis. He suffered a bleed in his brain. He pushed through. I left my rotation having cared for him for 3 weeks as his primary resident in an okay spot. I came back when he was corrected gestational age 36W. He looks amazing. He has maybe mild retinopathy myopia from the treatment of his retinal disease. He'll need glasses, but our ophthalmologist thinks he'll have okay vision. His gut is great and he no longer requires an IV. His lungs have every reason to look horrible and they just don't. Few markings, but he sounds beautiful and has no supplemental oxygen. His IVH is resolving. His brain MRI looks wonderful and he is acting like a normal 35-weeker. He will need to be watched closely, but even my jagged, battle-weary attending is incredibly hopeful. He's got every reason to have crippling medical issues, but all signs are pointing to him leading a relatively normal baby life. It's amazing. I have more. Kid in sepsis and dick oozing from every line, every orifice because his clotting factors were chewing up. He required ECMO, which is a lot like bypass in that it diverts blood out of the body into a machine that oxygenates it and removes carbon dioxide. I was on service when he turned around. Another dude, 14-year-old, shot twice by AK-47 in a US city. Not only did he get an ED thoracotomy, cracked his chest for a massive hilar injury that should have killed him, but he needed a huge chunk of gut removed. He then needed more gut removed because his initial repair failed. He survived a rather gnarly intra-abdominal infection and was looking like he would die a couple times. I took care of him for 2 months in the ICU, and when he was stable for transfer to the general pediatric floor, hugging him when he walked out was one of 3 moments in my career I cried so far. I have more. Edit. Well damn. I didn't know this would get so much attention. Here's a few more experiences I had. I'm back at a computer so I can type them out. So, I'm planning on specializing in pediatric critical care. So taking care of the sickest kids is sort of my dream job. I mention this because it's why I chose to do an anesthesia elective early in my first year. Managing an airway is one of the most important skills an intensivist needs to master, and you don't get a huge amount of practice in medical school. I had my PEDS PICU rotation late in my intern year. Thankfully, I didn't realize that I'd be tested my first day. I get my patient assignment and I'm both excited and nervous. My list is full of sick kids, figuratively and literally. And I'm hopeful to prove myself to my attendings and the staff. Low on my list of priorities is a little 22-month-old girl who's admitted to the ICU because she went from normal nasal cannula oxygen, looks like this, to high-flow nasal cannulae. For reference, nasal cannulae typically max out at a flow of something like 5-10 liters per minute, whereas the high-flow cannulae can go anywhere from 50 to 70 liters per minute of oxygen. We don't go quite that high, ever. So I walk into the room to introduce myself and I hear the hiss of the high flow delivering oxygen to a little curly-haired toddler who is gazing off into the distance. You can see the skin tugging between her ribs with every single breath. She's breathing like she finished a 2-mile run. Her pulse oximeter is reading 88%. She looks pale. Her lips are turning from lily pink to a deeper purple. She doesn't react when I listen to her or mess with her. Her parents have this look of just fear, and I remember hearing the mom shudder a little. Oh, thank God, when I walk up to examine the little one. Her oxygen saturation drops to 85%. Normally we like it at least above 90%. I turn up the fraction of oxygen, FiO2, blowing into her nose from 30%. We breathe about 21% oxygen to 40%. The sats don't budge. I learn my first lesson of the day. A PICU nurse walked in mid-examination. Stephanie. She's a veteran of cases like this. She gives me a sort of half-cocked smile and whispers, "Don't be a wimp before cranking the FiO2 to 100%. The sats hold at 87%. Her work of breathing doesn't change. I remember what I learned from my PICU rotation in medical school when my mentor taught me that one of the keys of being a good critical care doctor is learning to anticipate a clinical course. You pull back your view from the numbers on the monitor, the distraction of the people around you. You pull away from your own fear and try to predict the future. This child is going to tire out within the next hour, perhaps in the next 10 minutes. She's going to stop breathing and your somewhat controlled resuscitation will become chaos. And there I am, a first year resident telling my PICU nurse to start pre-oxygenating, which is essentially code for we are about to intubate, call the respiratory therapist, and call for help. I sort of expect her to buck the request. After all, I'm just a first year, but she doesn't. She meets my eyes, nods, and starts getting things ready. I turn to the parents next and explain what is happening to their child and my concerns. I explain that she may require a breathing tube. I talk about the risks. I talk about the benefits. I tell them my next step. I'm calling my attending, but I may be the one who has to place the tube. I wait for there's no way I'm letting you touch my child. Sure, you've placed some in an operating room, but that's a controlled environment. If you duck this up, my little girl is dead. Instead, the dad slides his arms around his wife and says, "Do whatever you have to do." I call my attending. I start telling him about the patient. He knows about the patient. He asks me a few questions. Her high flow settings, her clinical picture, her vitals. I'm on my way right now. He stepped out to get a coffee from the hospital cafeteria. But Brobofet, if you think you have to intubate this child, intubate her. He hangs up. Her sats start dropping again. She goes from sitting to laying flat on her back. Before I can ask, the respiratory therapist hands me the bag valve mask. I start bagging her, trying to time my breaths with hers. Her sats come up and I get my blade. The RT takes over bagging. The meds get pushed and I try to get to view with my blade, pushing the plastic into her mouth, past her tongue, attempting to slip the tip of my instrument just under her epiglottis. I remember to pull forward. I get a view of her vocal cords for a second and the epiglottis slips off. Duck. Her sats are 90 now. The senior resident walks in from nearby. He's an off-service ED resident who's rotating up here for a month. After watching for a bit I hear him say, "Oh, you got this," and leave. I want to tell him to stay but I can't lose focus. My attending walks in right as she's bagged back up to around 99%. I look over my shoulder at him, expecting him to step in. He just stands behind me and softly offers her, "Go ahead." I reposition her head, feeling her little blonde curls fall between my gloved fingers. I inhale for what feels like a minute and let it out slowly, slipping the blade behind her tongue. I lift and just barely see the bottom half of her cords. I'm just seeing it. My attending gently takes my pinky finger off of the blade and presses it firmly on the dense cricoid cartilage, what would make up an Adam's apple in a full-grown man. The rest of the cords slip into view. I pass the tube. It's confirmed. Her oxygen saturations come up on the pressure. A chest x-ray and later chest CT reveal that she has bilateral empymas, massive pus collections. Her simple influenza turned into a bacterial superinfection by a bacteria called Staph aureus. Fortunately for her, it's not the sort that's resistant to our most common antibiotics. I placed central lines and chest tubes in this little girl. I stood at the bedside while the cardiothoracic surgeon debrided pockets of pus from inside of her pleural cavity. I watched her walk out of that hospital alive. And 2 months later I got a thank you card from her parents. She turned 2. She's back to normal. She drew me a picture. It's on my fridge now. Sometimes I have a terrible day where the outcome isn't good and I look at that picture and remember that all the horrible stuff I see, the hours I spend away from my family and friends, and the stress of it all is worth it. I'm gonna head out now. I have to spend my one day off this week doing something fun and productive. Maybe more stories later. Thanks for the positive feedback. My brother had meningitis as a baby. From that he had mild brain damage in the frontal lobe. He had poor motor skills, decision making, incredibly irrational. At 18 he couldn't hop, terrible balance. He couldn't click his fingers. He struggled to catch a ball. 18 years old he is found collapsed in our house. Ambulance is called. He had meningococcal 6 days in a coma. He doesn't cooperate with the physios, puts very little into his recovery. The meningococcal caused more damage to his brain. Whatever happened this time reversed the previous brain damage. He could click, hop, play ball. He is now a stand-up surfer. His decision-making abilities and everything else are normal. He's one of the best engineers in his field. He is incredibly successful and talented and such a driven human being. All of this wouldn't have happened if it wasn't for his brain being further damaged. Stroke patient. One side of his body was paralyzed. He walked out less than a month later. No physiotherapy and no permanent damage. Guy's over 80. Dead for all money. Been lying in bed on death's door for days. Hasn't eaten. Hasn't moved his head. Hasn't spoken. Hasn't even looked at you. Sits bolt upright and says we got them. Then lies back down and dies. I mean, it was short-lived, but very unexpected. I'm not a doctor, but I'll share one that's personal to me. A little over a year ago, my little sister was hit head-on by a drunk driver in a collision at about 70 miles per hour. The guy had gotten the wrong way onto the highway, and at the time she worked second shift. First, the collision happened about 3 AM, and no one found them until 5. They thought that she was dead when they pulled her out of the car. However, several transfusions on the way to the hospital later, she actually makes it there. When I got to the hospital at about 8 PM that day, everyone thought that she wasn't going to make it through. The nurse who admitted her actually came in that night to check on her off shift to see if she made it. I've never seen anyone look that bad. Literally her entire body was black from bruising. She lost her spleen, half of her liver. She had lacerations internally on her stomach, and the entire left side of her body was pretty much crushed. Her hip was broken. Her pelvis was fractured in 2 places, and I can't remember how many surgeries she had over the course of the next 2 weeks, but it was a lot. That time period is pretty much a blur for me, because she was in a coma for a lot of it, and sleeping on a chair beside a hospital bed in the ICU is not the most comfortable thing in the world. I'm pretty sure I didn't sleep for 5 days. However, she pulled through. She woke up out of her coma on day 4. The crappy thing is that she's allergic to morphine, so they had her on 2 sedatives and 2 different painkillers and an allergy medication. To say that she was out of it would be an understatement. Her doctor told her that she couldn't eat for at least 2 weeks. She started doing that after about a week. They told her she wouldn't leave intensive care for over a month. She did in 2 weeks. She was home after 3. She was told that she wouldn't walk for at least a year because of all of the damage to her body, all of the pins and plates that she had, all of the surgery she would need, and time for her hip and pelvis to heal. She took her first steps completely unassisted after 11 weeks and never turned back. At the time she had a 3-year-old and an 8-month-old who didn't really understand. It was really hard, especially because she couldn't even hold the baby without being in massive pain for a couple months. I think it was probably 4 or 5 months before she slept in bed again. She truly amazed everyone there, and I know every one of my family. If you made it to the end of this, don't drink and drive, folks. Nurse here. I have a pet starling. I'm on my 3rd one. My first one used to sit on my shoulder everywhere I went. To the store, my parents' house, and even work. I'd bring him in on my days off to entertain the patients, especially the old folks and kids. Had a woman in with bilateral strokes. She was paralyzed on both sides and was totally immobile. My starling hopped on her belly and she concentrated as hard as she could and was able, for the first time in many days, move her left hand up to pet the bird. That was the start of a pretty amazing recovery. She never walked again, but got the use back in her arms. My father is a doctor in family practice. Our area has a high rate of diabetes. When a patient gets diagnosed, a certain code is put on their record. A few years ago, a typo in the system led to the code for diabetes being the same as dwarfism. So for that entire year, my town had the highest rate of dwarfism in the country. Nurse here, not a doctor. I remember distinctly a guy in his 90s with a lot of comorbidities from a nursing home. Placed him in a side room cause he was chain-stoking death rattling. Grey with purple mottled peripheries. Vital signs awful. The usual. Go to check on him half an hour later expecting him to have passed. Nope, he's got about half a liter of sputum all over his chest. He's alert and all his vital signs are now fine. Was discharged a few days later. I had a young woman who came in septic from pneumonia. On full inotropic support. Still deteriorating. Adult retrieval assessed her and declined our request for ECMO because they thought it was futile. The pressures required to ventilate her caused a tension pneumothorax. She arrested 3 times. Ended up ventilated for 2 months. Multiple failed attempts to wean her off because of critical illness myopathy. Eventually, after a 4-month stay, we got her to rehab. Sickest person I've looked after who lived. I have family in the medical field who shared this story with me. There was an old couple, husband and wife, who had been married for 40+ years. They were the kind of old couple who still loved each other deeply and went on dates together. They had a tradition where anytime they went out for supper, the husband would order pie for dessert. And although the wife always claimed she didn't want any and refused to order any, she would swoop in and steal the first bite of his pie every single time, to his constant annoyance. But then the husband began to develop a type of dementia, possibly Alzheimer's. I can't remember, where he started to slowly forget who his wife was. At first he recognized this woman as being someone in his life he knew and loved. But when they met around the house he would still ask her where she was. Things like, "If you see my wife, let her know I'm looking for her." Eventually it progressed to the point where he didn't recognize his wife at all and became visibly distressed by living with a stranger. So he moved out of the house and into an assisted living style apartment. She lived alone, visiting him whenever she could, but he never had any idea who she was. Even seeing pictures of them together from their past visibly confused and distressed him. One of the docs recommended that the wife should start taking him on a few dates as if they truly were strangers, so that the husband could at least gain a new kind of familiarity with her presence and maybe become friends. So she took him to a restaurant they had been going to their whole lives and had dinner. They had some nice conversation. Afterwards he ordered pie, and without thinking she reached across the table and stole the first bite of it. The husband looked annoyed, but then suddenly seemed shocked and confused, and then started crying. Everything had come back. All the memories, all the love, all of it. Something about that action triggered something in him and he was able to get back to who he was. They moved back in together and were able to pick up their lives again. Unfortunately about 5 years later he began to regress again. But they still got 5 more years together than anybody thought they would be able to have, which is really amazing and pretty miraculous. Screw it. I'm a doctor and I'll weigh in. I treat brain aneurysms, strokes, and a few less well-known things by working from inside the blood vessels. Lady had an aneurysm pop. She was the highest grade in both state and consciousness and amount of blood. Hunt has 5/Fisher 4. 10% chance of survival. And basically all of those are neurologically devastated if they live. Most of the time we don't even treat the aneurysm, they are doing so bad. She comes in, intubated, no corneal, eye blinks when you touch it, or no gag reflex. Both of these are low-level basic brain stem function, usually the last to go before someone dies. I think one pupil may even have been dilated. She's basically dead. Have family discussion. They understand. We wait 24 hours. She basically turns the corner the next day. Decide to treat aneurysm 48 hours later. But all of us are like, WTF. How is she doing this well? She had a long road with pneumonia and bowel obstructions and scattered things. But she left hospital for rehab pretty intact. Obligatory, not a doctor. Not miraculous but certainly eyebrow raising. My husband's grandmother's body created its own bypass. The blockage was like 90-something%. Her body created its own vessel to bypass the blockage near a major artery leading into the heart. My sister's tonsils grew back after having been scraped out when she was little, 4 or 5. I sat in the waiting room with my mom when she had them removed. She was diagnosed with tonsillitis when she was in her late teens. My mom is 50, smokes like a chimney, drinks nothing but soft drinks. She was in a car accident that caused a clot to form in her neck and that clot got loose and caused a stroke. She made it to the hospital and only suffered minor short-term memory loss, and she lost her addiction to nicotine and caffeine for a short time. She started back up at 3 months afterward. There were people much younger than her and in much better physically with the same situation worse off that she was. I'll jump in. Not as a doctor but as a patient. At 17 I started going blind due to a rather large tumor taking up most of my sinus cavity. It was pressing against my optic nerves, which is why we discovered it. This was called an angiofibroma. That is a story in and of itself, as I was subject to a new method of incredibly invasive surgery where they basically remove the entire top front of your face to get to it. About a year later I started to get a fever. I went to school trying to power through because my friend had gotten tickets to Kids in the Hall's reunion tour, early 2000. While at the show I felt worse. Nauseous high fever. I really shouldn't have been there. I got home about midnight and my parents were still up, and when walking through the door they immediately got very worried. My face was noticeably swollen and my fever was at 105. So having been just under a year since my major cranial surgery, they were very concerned. We went to the ER at St. Joseph's in Phoenix where my doctors were. They were slow to get me in until finally my dad started yelling for them to actually look at my face to see that the swelling was still increasing while sitting in the ER. The staff finally looked up from the computer and I remember the look on their face. The neurologists at Barrows were immediately notified and I was admitted into ICU as they were going to do an emergency surgery and there was no point switching rooms. My white blood cell count was so high that the blood draws looked watery. The hypothesis was that even though it was a year since surgery, some bacteria had gotten in and suddenly had explosive growth. They were going to go in, peel open my face again and scrape all of the tissue from my bones and go through a rigorous treatment of antibiotics. My head was shaved, catheter in, and anesthesia administered. The next thing I remember was waking up in a post-op room with another patient yelling and the nurses trying to deal with them. I felt my head for the staples and they weren't there, just bare skin. I asked what happened and the nurses, busy with the other patients, said that I didn't have surgery. When I asked why, they just said I just didn't. Something happened. So as I woke up further and got into a room, I finally saw my surgeon, Robert Spetzler for those wondering, and the infectious disease doctor. They told me that while they could see the invade room was raging in my head and they knew where, they still wanted to see if there was a location that it was more isolated to. So they drew small blood samples from 3 areas in my head and all 3 samples came out completely clear of infection. In a matter of minutes my swelling subsided and the fever was gone. The ID doctor said that there was no explanation as they had not administered any antibiotics. They put me on IV antibiotics for a few weeks, but I was told that it was only to cover bases as they were completely confident that the infection was gone and they didn't expect it to come back. And it never did. It's been 17 years. TLDR. Got a raging infection that suddenly disappeared moments before the knife was going down for a rather intense and painful surgery. I'm just an EMT. I once witnessed an 80-year-old woman go from conscious and talking to working code, no pulse, not breathing, to pulse but no breathing and back to awake and oriented with zero memory of her 8 minutes of pant-sitting terror. We never initiated CPR, pushed no drugs, and only gave her a few breaths from a BVM. There's no doctors weighing in, so I'll share a story. My grandfather. He was in the worst car accident you can imagine. The whole one side of his vehicle, the side he was sitting in, was smashed to basically nothing. Had to go into an induced coma, and then once he recovered, he had a metal plate placed in the side of his face. Though we truly believe the car accident, due to the nature of head injuries, caused his early onset diagnosis of Alzheimer's. Car accident in his 40s. Died at 67 from Alzheimer's. Intelligent man. Miss you, Pop. I've needed to read this today. Have a patient on the inpatient floor right now who is pretty close to passing. Family is in denial. Makes me feel like a failure sometimes. These stories help me keep going. We are stationed in a very remote area, so some conditions usually treatable or manageable in hospitals with adequate facilities are far more serious here. There's one recent guy that come to mind. The patient was clinically suspected to have an intestinal perforation. The astonishing thing was he had been symptomatic for 8 days. He did not mention why he sought treatment so late, but my bet's on his financial situation. We were surprised he wasn't dead already. His lab reports from the ER were haywire. He was planned for surgical repair in the ER, and had to wait another 16-18 hours for his turn. There's just one OT. When we saw him prior to surgery the next day and noted his status, we were fairly certain he would not make it back from the table. After thorough counseling, we got a high-risk consent from the family. A kind surgical resident offered to pay for the procedure for the time being. In op, he had a sigmoid perforation with gross fecal contamination. The repair was successful, but anesthesia could not extubate him. He needed an ICU bed, which we did not have, all taken. There was a hospital with an ICU bed an hour's drive away. They loaded him in a vehicle, with a family member bagging him and monitoring a noradrenaline drip titrated to last almost exactly an hour. Drip goes too fast and the drip's gone. BP gone and patient gone, and a family member was looking after that all the way. He made it though. I will never understand how. There's some that we lose so unexpectedly, and some that just refuse to go. My uncle came back from a stage 4 cancer. He looks better than he ever did, and I think the cancer made him less of a prick. I'm a knob, and I delivered a baby with newborn leukemia. This baby looked like it had no chance of life with an enormous belly of ascites, hydrocephalus, leukocytosis off the chart, and so on and so on. This baby was transferred to a university and started on chemo at 1 day of life. I saw the baby at 6 weeks and was completely cured and normal in appearance. I got one. I had a patient that went into cardiac arrest and was found in refractory VFib. It means his heart wasn't pumping and was just quivering like a big ball of jello. Normally this is fixed by shocking it and typically converts after 1 of 2 shocks or they flatline. This dude spent 45 minutes getting CPR and was shocked 15 times on the way to the hospital, so his heart was basically stopped for an hour. He was brought to the cath lab, put on ECMO, which is a heart-lung bypass machine, and 2 stents were placed. He walked out 3 days later. To this day it's one of the longest instances of someone being in VFib and surviving. Patient with chronic depression with suicidal ideations. No meds worked. He tried MAL for over a decade. Sent him for a sleep study. Obstructive sleep apnea was identified. Put him on a CPAP. His whole life changed. He was really thankful to feel good again. He teared up when he thanked me.